humerus, so I'm going to place my hand at the distal end of the humerus. Okay. Some of your patients may be so large and you may be so small that you may have to make a modification and increase your force arm. That way you can get them to break. Okay. But for all intents and purposes, at the distal end of the bone where the muscle attaches. Okay. What I'm going to do is I'm going to provide stabilization to the back. What I'm going to do is I'm going to provide one point of contact so he knows where to push. When I say push against my hand, he knows what I'm wanting to do. If I do this, put my grip around him and say, push against my hand, he may say, okay? What I like to actually say is one point of contact and say, hold this position. And then I will apply pressure. Now, one thing we're not going to do is hold this position. Okay? We're not going to jump on them. All right? It's kind of like an isometric contraction when you're strengthening. You're going to gradually increase your pressure until you hit maximum pressure, and then you're going to gradually let it off because we don't want to do this. Okay, hold this position. Good. Okay. Because that could hurt your patient. So I'm going to say, sit up good and tall for me. I want you to hold this position. Don't even move you. Hold, 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 hold. Good. Relax. Now, what we're doing is the break test. Okay. As soon as we can break them out of that position, test is over.
So do you constantly put more pressure down as you're?
Yes.
Okay.
Ryan, can you attest to that? Hold, 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 hold. Good. Relax. Now notice I gave them the relax command. Okay, that art, not science. That tells them that, okay, I'm done testing now, you can start relaxing that muscle. So we're not jumping on them and rubber banding them around. Right? So, hold this, hold, 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 hold. Good, relax. Now how am I going to tell if that's 4 or 5?
Test the other side.
I'm going to test the other side. I've already passively arranged the motion that so I can see what he has. Can you raise that arm above your head? Good, back down. I want you to hold this position, don't even move. Hold, 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 hold. Good, relax. Are you right or left-handed?
Right-handed.
Right-handed. So what I noticed was that this shoulder was a little weaker than this shoulder. Does that mean this is 4 and this is 5? We could argue that till the cows come home. I personally would say that this is 5 and this is 5 simply because most of the time the non-dominant hand is going to be weaker than the dominant hand. The only times I see exceptions into that is if I'm treating trained athletes who are in the weight room that are working each side equally. They tend to have more equal strength on both sides. So you have to know your patient population that you're working with. Okay? Now I know that you're becoming a trained athlete, but you're becoming one. You're not one quite yet.
Facts.
All right. So, this is the gravity, the anti-gravity position. Anti means against gravity. So, what we've got to do is we've got to see about flexion. Now in the horizontal, if we wanted to assess, let's say I went like this, boom, I raise your arm partially. Is that all you got? Okay, good, relax. Now, I cannot give him a 3 because he can't move out of the through the range of motion. So the question becomes, do I give him a 3 minus or a 2 plus? All right, so what I have to do is I have to put him in a gravity eliminated position. So lay on your side for me. And this side for me. So now I'm going to relax. I'm going to support. See, if I hold that right there, just hold it. What's active right now are not his flexors, they're his abductors, right? His flexors should be fairly relaxed. So, but what I'm going to do is I'm going to support that arm, relax. Okay, I want you to raise your arm above your head. Okay, good, like that. Now that is a full 2. Okay, it's a full 2. Now if I went like this, raise your arm above your head. Raise your arm above your head. Come on, all the way up. Good, relax. Now I want you to hold this position right here. Hold that and then just let it break over. He was able to withstand some resistance against me. That would be then a 2+. Okay. Now what does a 3- look like?
You can go through it on its own.
So now I got to set him back up. Raise your arm above your head. Okay. It's a 3. Actually, raise your arm almost up, 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 up. Is that all you got? Right, good, relax. Now, I'm going to place him here. I want you to resist me. Hold, not break over. He was able to stand a minor amount of resistance. He couldn't get the full 3, but he was able to get most of the 3 and able to withstand a little bit of resistance. That would be a 3- versus a 2+. Make sense?
What about if you were laying down and moved through the full arc with no help? Or is that essentially what you did?
Yeah, that's essentially what I did to establish 2.
Okay.
But then, isn't that more weight than gravity would be? So wouldn't that make it a 3+?
No, because he couldn't go all the way through the range of motion.
Okay.
He could go all the way through the range of motion, and then he came back here, hold this, break over. That would be a 3+.
Mm-hmm.
Because he's not being able to provide moderate resistance, he's providing minimal resistance. So he could go through the full range of motion to establish the 3,
Mm-hmm.
but he can only take a minimal amount of resistance, then I have the 3+. He can go through the full range of motion, establish a 3, come here, hold this. He gives me a moderate amount of resistance, then I'm at a 4.
Right.
And we don't use pluses and minuses at 4 or 5. Okay? My book talks about it's really not that super important about the plus and minus system unless you're dealing with certain pathologies. And the example my book gives is Guillain-Barré. What do you remember about Guillain-Barré?
Knee syndrome.
What's that?
Knee syndrome.
Knee syndrome?
It has to do with their knees.
No.
You thinking of Osgood Schlatter?
Osgood Schlatter. Guillain-Barré.
Guillain-Barré is a
Very
demyelinating disease of the peripheral nerves that starts distally and works itself proximally. Right? It's thought to be caused by the same virus that causes mononucleosis, the Epstein-Barr virus. Is this all starting to sound familiar? Typically, patients will go from here, they'll get weaker. Once it reaches the diaphragm, they're put on a ventilator, and hopefully, after a period of time, everything will start remyelinating and start working its way back out. If they get full recovery. If they get partial recovery, they get partially back way out. So, with Guillain-Barré, if they're totally paralyzed, any type of resistance from 0 to, raise your arm above your head. Raise your arm above your head. Just give me a little bit. Huh? There you go. Now I'm feeling a little contraction. That's a huge amount of difference from being totally paralyzed to now I'm starting to get a contraction. And then now I start getting a contraction with a little movement. That's another huge step. So that's when those pluses and minuses really come in handy. Also, it's a way of showing progress in your orthopedic patients. If you initially have a strength grade of 3-, and then now they've got a 3 or a 3+ or a 4, you can say, look at all the progress I've made, or that the patient has made, that I have facilitated. Because in your documentation, you always want to make progress. In the state of Oklahoma, in the PT Practice Act, the Physical Therapy Practice Act, it says that if in 30 days I see no progress, I by law have to refer my patient out to somebody else. So that goes a long ways in helping show progress.
So if the patient like has an illness to where they'll never get to a 5, do you still grade them like 3, 4, whatever they are, even if that's the farthest or best they'll ever get at?
Even if that,
Answer this, but
take this down so I can hear you.
like, say they can only get to here and we'll never get any further than that. Will never be a 5.
It will never be a 5. Yeah, their new normal isn't a 5. Their new normal is now a 4. Okay, and it's important to note the difference between full range of motion and full available range of motion. Normally when we say full range of motion, when we're talking manual muscle testing, we're talking full available range of motion. Let's say he had a pathology like a frozen shoulder or adhesive capsulitis, and that's all the range of motion he had. If we go by the strict definition, full range of motion, he will never have anything stronger than a 3 because he can't get up here. So, but he can move through this full available range of motion against gravity, then he qualifies for a 3 out of 5. Make sense? So normally when we talk about moving through the full amount of range of motion, we're talking about moving through the full available range of motion. Right?
What if they have like this much range of motion, but they can withstand a great amount of resistance?
A great amount of resistance? Actually, instead of great amount, we're talking maximal resistance. They're able to give maximal resistance or moderate resistance. It's not that they withstand a maximal amount of resistance from us, because my maximal amount of resistance may be able to break everybody over here but 2 or 3 of y'all. Okay? That would mean that the rest of the 80% of you guys are not going to be able to get a 5 out of 5. Okay? It's the resistance they give back to you. Okay? And it's kind of confusing right now because your database that's in your brain for strength testing is about the size of a thimble. Okay? You catch on pretty darn quickly. Right? You catch on pretty quick.
So if they're able to do that, maximal resistance in that limited range, does that indicate more of like an osteopathic or musculoskeletal pathology going on? Or
Yeah,
what?
yeah.
It's not. Yeah.
Let's say Ryan had a UCL replacement. We see this all the time in baseball players. Had UCL replacement, right? And he's been immobilized or partially immobilized in a brace, okay? We come out of the brace and we try to straighten him out. We can only get him to 10 degrees. We go 10 and we try to bend him up and he's only got 100, so it's 10 to 100 degrees, okay? Then I go to strength testing. Hold. He may still have 4 or 5 strength, even though he doesn't have full range of motion. So it's within his full available range of motion. The mask is not wanting to stay up today. So the anti-gravity positions for most of what we do, I can't think of an exception, is in the vertical plane because gravity pulls vertically. The gravity eliminated is generally in the horizontal plane. Okay, let me show you elbow flexion. Sit up good and tall. Flex your elbow. Boom. Right. So I can automatically give him 3. It's in the vertical plane, right? Now let's say flex your elbow, not all the way up. Relax. shake for effect there. Did you get that on
It's
camera?
good acting.
I try. I dabble.
So he wasn't able, so now I have to work down the scale. The best he can get's a 3 minus. Actually, he can't even get a 3 minus because he couldn't go against the good. Best he can do is 2 plus. So what I'm going to do is I'm going to take him and put his elbow flexors in the horizontal plane. So I'm supporting here, and when he activates his bicep, he's not fighting against gravity, he's fighting against air resistance. So flex your elbow for me. Flex your elbow. Good. Now he's got 2. Flex your elbow for me. Hold that right there, don't remove you. Hold. Aha, he can withstand some resistance, so I can give him a 2 plus. Right? Everything that is going to be below 3, 2, 1, 0 is tested in the horizontal plane. It takes a little thinking to do to get in the horizontal plane. Let's say I wanted to do knee extension. Okay, straighten that up for me. Okay, what can I give him?
3.
Okay, I'm gonna put him somewhere about halfway. I actually should have a towel underneath him. At the very least, what I can do is put my hand underneath him, because what's gonna happen when he pushes up against this, his thigh is gonna cram down into the table, it's gonna hurt. Okay, come to this position, hold it right there, don't move, hold. Hold. Good, relax. I felt he gave me maximal resistance, so it's a 5 out of 5. Now let's say, this is range of motion, relax, don't go through it all. Is that all you got? Yes, that's all you got. So I can't give him 3, right? So what position am I gonna put him in to test to see if he's got,
Sideline.
what did you say?
Sideline.
Sideline, so lay on your side. So I'm going to support the leg, however best I can support it. Scoot towards me so I don't kill my back. Okay. Now straighten your leg up for me. You can go through the full range of motion in the gravity eliminated position or the horizontal plane. Now he gets a 2. I could go further, hold that right there, don't even move you, hold. Okay, he's giving me some resistance, so I can give him a 2 plus. Now, that is textbook. That is textbook. That's the way I want you to learn, that's the way I want you to practice, because that's the way you'll be tested. Clinically,